Morning, good afternoon, and good evening. I will just give our colleagues a couple of more minutes to log on, and then I suggest we start in around 2 to 3 minutes with our webinar. Okay, so we are 3 minutes past the hour. I think we can start now. People are still logging on. This is the Global Brain Health Partnership. It is one webinar of a sequence of webinars, and my name is Andrea Winkler. I'm a neurologist and a professor, and I'm passionate about brain health from the Technical University of Munich, Germany, and more precisely from the university hospital there. I just give you a little bit of information about what the Global Brain Health Partnership is. It is also called the TUM-Harvard Global Brain Health Partnership, how it came about, what its purpose is. Before I come to the topic of today and to the introduction of our two very eminent speakers from Malaysia and India. And also a big shout out to Laura Roth, who is helping with the webinar, who is the science manager at the Center for Global Health at the Technical University of Munich, from which we are operating from. The TUM-Harvard Global Brain Health Partnership, in fact, is a community of practice. It's a platform for exchange, knowledge sharing, sharing of ideas, especially with the focus on low and middle income countries. And most important to us is that it is driven by the countries. The idea was generated during my time at Harvard Medical School, more precisely at the Department of Global Health and Social Medicine, together with Dr. Kee Park, who is a neurosurgeon. And it was in 2023, in fact, just a couple of months actually, after the official launch of the Intersectoral Global Action Plan on epilepsy and other neurological disorders by the WHO. Of course, since then, lots happened, but we are all still very committed to the IGAP, the Intersectoral Global Action Plan on epilepsy and other neurological disorders. And the Global Brain Health Partnership can really be viewed in this context. It is bringing out the message to the people, but also hearing from the countries themselves how they are tackling and dealing with brain health. Brain health for us is a very holistic concept. It is neurology, it is psychiatry, neurosurgery, neurodevelopment, public health, economy, etc., all in the light of the health determinants and all in the light of policy. evidence translation into brain health policy. So we are basically on a mission of brain health, and we would like everyone to be part and all the different disciplines also to be part. So that is the context. And now, without further ado, I would really like to introduce our first speaker, which is Professor Rajendra Damecha. And I have known Dr. Damecha now for quite some time. He's a very good friend. It's always a pleasure working with him. He, in fact, is a very distinguished professor of neurology and the director at the Institute of Human Behavior and Allied Sciences in New Delhi. And you bring with you, Rajendra, a vast experience of over 30 accomplishments in the field of neurology, but not only that, also public health. And your emphasis is a bit stroke, movement disorders, but also, and this is where you and I have touched base, not just recently, but brain health. And you are very much in the forefront and also a forerunner, I have to say, of brain health. You are widely published in over 200 publications in peer-reviewed journals like Nature, Lancet, Neurology, you name it. But also more recently, and what is interesting to us, you have been appointed chair of the National Task Force on Brain Health by the government of India. And that is really something. You have made headway, you have finished the report, and I guess you will tell us more about this incredible journey. In a nutshell, Rajendra, you are a sought-after advisor, and you have contributed to prestigious organizations, platforms globally and locally, and your impact really extends across borders, shaping neurology not only in India, but also beyond, not only clinical neurology, but also medical education. And without further ado, Rajendra, we look forward to your presentation, which will be followed by the presentation of Dr. Jafri, our colleague from Malaysia. Thank you so much.
Thank you, Andrea, for the kind introduction and for organizing this webinar from the Global Brain Health Partnership. It is indeed an honor and privilege to be worked with you. And for last 2 years, we have been working together for our passion in the brain health and working on a global stage, whether it is the United Nations or it is World Health Summit or even the partnership which is evolving from Africa to India to now to the Malaysia and the global south. So I'm looking forward for such interactions, such webinars in future also, which will extend our commitment to spread the brain health concept across the globe. Thank you very much, Professor Jafri, also for taking time out. And thank you, Laura, for having us on this platform. I'll just start sharing my screen and let me start this. Is my screen visible now?
It's coming. Yes, again, it is perfect. It is also in presenting mode. Thank you very much. Please go ahead.
Okay, so let me see my screen. All right. So, as Andrea mentioned that I head the National Task Force on Brain Health from the NITI Aayog, which is the Planning Commission headed by Honorable Prime Minister of India. And we have been working for last couple of years, since April 2024. And we have stakeholders from 𝐴𝐻 Bangalore, from Malin Institute of Medical Science, makers, representative from the different ministries from the Government of India, including the Ministry of Health and Family Welfare, Ministry of Social Justice and Empowerment, Indian Council of Medical Research, Department of Health Research, and other associations and stakeholders working in the field of neurology and psychiatry and public health as well. So it's really a task which is given to us by the Government of India following the WHO commitment in the 75th General Assembly uh, 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 on the global action plan for epilepsy and other neurological disorders, which is a mandate for 200 countries to adopt brain health action plans and devise and work the SDG Goal 3, which is the health. And then they have the priority areas set up for the countries to commit to the brain health cause. So, as you know, 1 in 3 people affected by neurological conditions in the world globally. So, around all of us who are here, I would say it is actually 1 in 2, not 1 in 3, because the neurological conditions tend to be underdiagnosed, have a lot of stigma, people do not come forward, and there is a handicap to that also. So, the numbers are quite high, the absolute numbers. So, more than 3 billion people suffer from the neurological disorder, one or the other neurological disorders, and have ill health and disability, including the mental health disorders. So, why we are talking about brain health, why it is important as we have this webinar and a lot of activities, whether it is the research or the economics, they are happening across the globe. Every month we have a summit or we have a meeting on global brain health or a brain health, where it is linked to brain capital, brain skills, and brain, or it is the neurological health, or it is the brain health in women. So all of these activities are happening, and they are very very aggressive technological services being stepped up and escalated across the globe. So the ideally the good brain health is vital for reducing large and growing neurological burden. That is very important, and of course it goes beyond the absence of disease. It doesn't mean that you don't have a disease, even then you have a poor brain health or brain negative economy, what we call. So it goes beyond the absence of disease or treatment of disorders or rehabilitation, and it includes the preventive measures or promotive measures to decrease the incidence of neurological disorders, enabling individuals to function and cope with their life situation. So optimum function and coping strategy and resilience. These are the three major things which we talk about when we say brain health. There are different definitions of brain health, but I'll come to that a little later on. Let me tell you the brain health burden of disease, why we are talking about this. Number one cause of disability, number second cause of death worldwide, and of course, the more important thing is that global south. So, two-thirds of neurological burden or disease falls on lower and middle income countries, including the subcontinent or the Asian and the Central Asian countries, Africa and the South American countries. So, despite the growing threat to brain health, despite very aggressive approach from the WHO and other stakeholders and developmental partners, still there is a limited policy response in many of the countries, including the global south. So, talking about Indian perspective, so there are more than 507 people living with neurological disorders, and that accounts for of Indian population. And these are the numbers which actually highlight what are the priority areas in the neurological disorders or mental health problems, and what are the diseases which are contributing to the health loss or in India and the neighboring countries. So these are the GBT data, which is now published. It was the earlier slide, but now it is published, widely quoted and cited. So stroke still ranks the number one in India and as well as in other South Asian countries, followed by neonatal encephalopathy, migraine, or other headache disorders, preterm birth, dementia, a very very important aspect of today's discussion because we are having the aging population, and then of course diabetic neuropathy, epilepsy, meningitis, infections, and of course the intellectual disabilities or autism spectrum disorders and all this. You can see the on the right side that there is a difference side and global side. Globally, this ranking is different. In India, ranking is different, and of course, more or less first five are the same, or the first four are the same. So in India, we have more than 9 million deaths, around 16.5% of total global deaths happening in India because of the neurological disorders, and that ranks as number two in the leading cause of death after the heart disease. In terms of disability adjusted life years, we have 276 million, and that accounts for 12% of global disability adjusted life years again, number one leading cause of disability. And prevalence of neurological disorders is as high as 2,400 per 100,000 population. That's our own study, which we published a few years ago. This shows that we have huge burden of disease attributed to neurological disorders and preventive promotive brain health, which includes the curative and rehabilitative and palliative wings also, can make a big difference if we invest in the brain health and make our population brain health uh, healthy. So I was just alluding to the dementia, which is now the aging population in many countries. India is a double whammy. We also have a young population. We also have a old aging population. The absolute number of 1.5 billion people living in this country. Practically every fifth or sixth individual in the global population lives in India. And the dementia causes healthcare costs around 150 billion rupees. That's a huge amount. It's not only treatment costs, but also losses because of the cognitive decline and because of the dementia and related illnesses. The aging population now at present is more than, 12.3%, but it's going to double in next 25 years, and that would result more than 300 million people living over the age of 60 years by 2050, and with consequent increase in the dementia patients by three times. So these individuals will not be living as a normal life because they will have a lifestyle disease and a cognitive decline, and that makes the things worse. So we have this study, we are part of this burden of neurological disorders across states of India, the GBD study 1990 to 2019, which was published in 2021, and this is actually a real picture depicting from the states of India, because India has 35 states and union territories, 36 states and union territories, and you can see the different states have different uh, disease burden depending upon their social demographic index. But there are three clear messages from this study, GBD 1990-2019 study of neurological disorders across different states in India. So number one is that the contribution of non-communicable neurological disorders, that means degenerative disorders and vascular disorders, they have doubled from 4% in 1990 to 8.2% in 2019. So that shows that we are now dealing with non-communicable diseases, often neurological diseases on the brain, which is again increasing as we are having more and more people living over the age of 65 and 70. The age when we got independence was 47 years. Now it is more than 72 years. So obviously, the numbers have gone up, and so are the number of disease patients also have gone up. The other important thing is the contribution of injury related, which is actually head injuries and of course the spinal cord injuries. They have also tripled from 0.02%, 0.2% to 0.6%. So that again shows the young people, the motorbike riders, and the traumatic brain injuries going up. The traumatic spinal cord injury also going up. So that is the second message from this GBD study. And of course, on the other hand, the contribution of infections related neurological disorders have actually gone down from 4% to 1% during the last 30 years, from 1991 to 2021. So that is something, three clear cut messages, and that is the socio demographic index showing us that we have gone from non communicable to communicable disorders, that is having a epidemic of these disorders. The largest contributor to the total neurological disorders, then stroke ranks number one, followed by headache disorders, and then epilepsy, cerebral palsy, neonatal disease, and of course infections of the brain and spinal cord and meninges. So that is again things which are maybe different from the other parts of the world. So this is the map of India showing three different aspects. Of course, one is the injury-related neurological disorders, and second is the non-communicable or the neurodegenerative and vascular disorders, and third is of course the infection-related neurological disorders. So you can see the red map, the green, the blue map, and the yellow map having a different numbers. So the crew daily rates more than 250 per 100,000 means the injury related have gone up in certain areas which have a high socio-demographic index or the high income groups, and the non-communicable again in some of the states like Maharashtra, Karnataka, Delhi, Punjab. So those are the rich areas, the states, and they are reflected in their different profile of the neurological disorders, including injury-related and non-communicable. On the other hand, which are the poor states like Madhya Pradesh, Uttar Pradesh, Bihar, they still have the infection-related neurological disorders, and that goes because of the many reasons, whether it is the economic conditions or it is the sanitation and other things. So these are things which tells us where to invest, where to target the addressing the public health aspects of the neurological disorders. And we have been highlighting this, that India is grappling with rising burden, many platforms, and this is one of the opinion piece in national dailies. And there is a 1.5 billion population has a prevention paradox, which Geoff Ross, a famous epidemiologist, described. If you have a large number of people at modest risk, like in India, 1.5 billion people, even a modest risk may give rise to more cases in a small country like Germany, a small number of people, like in a country in Europe, having a big risk. So obviously, absolute numbers become very high depending upon the country with a large population or a small population with a smaller number. So depending upon the modest risk or the high risk and the number of people living in that country, we can define the epidemiological aspects of this. So coming to the human resource, again, a very dismal condition. This is one chart published in Neurology India. The Indian scenario, less than one neurologist per million population. Now it has come a little higher, but still we are lagging behind. They look at the numbers in China, look at the numbers in Japan, Taiwan, high, ranking high. So you can see the number of neurologists are very little. They are less than 4,000 neurologists with a country of 1.45 billion people, and that also have a regional inequity. That means the neurologists are mostly practicing in the urban areas, in the metropolitan areas, and very less in the rural population in the country, which is around more than 10%. So there is a lot of discussion about the brain health and mental health, where they are correlated, where they stand to each other, whether brain health includes mental health or they are the different entities. Are we discussing the mental health also? So we have an opinion that mental health is a part of the brain health, and of course, the brain health is important determinant of mental health across the life course, whether the infancy or in the youth and adolescents, or in the middle age or in the elderly population, because many of the risk and protective factors of mental health, including the social adversities, pollution levels, physical activity, they are the same. They work through the changes in the brain chemistry, brain structure, and brain function. So obviously, when we say brain health is a state of brain functioning across the multiple domains, allowing a person to realize their full potential over the life course, irrespective of the brain presence and absence of disorders. On the other hand, mental health is a state of mental well-being that enables the stress of life, realize their abilities, learn well, work well, and contribute to the community. So that is a very important component, and that is overlap. So we think that brain health should include the mental health, and that's where we have a very strong conviction in that. I'll just discuss about the uh, economic aspect of the neurological disorders. You can see India is now fourth largest economy in the world with more than 3.5 trillion economy, and two-thirds of this, if you calculate, more than 2 trillion US dollars is the losses or brain health losses, which is equivalent to two-thirds of the GNP of India, with country with over one-sixth of world's population. So you can see huge economic loss, huge economic expenditure on treatment, and of course, because the poor brain health, the economic losses because of the GDP. So with that, the family from the WHO, this intersectoral global action plan on epilepsy and other neurological disorders for the 10-year roadmap. Around 200 countries supported the adoption, including India and Malaysia, I believe. And of course, this was a turning point and a revolution in the neurology, as World Health Organization and its member states are now committed for prioritizing brain health and addressing the burden of neurological conditions at global level, regional level, national level, state level, and at the village level. So obviously, this is a turning point, and here we are talking here after this WHO Intersectoral Global Action Plan, and which is now come into action, and India being the leading country in constituting a national task force on brain health from the government of India, and that is coming up with the National Brain Health Action Plan. And of course, we have been seeing the action at various forums, including the United Nations General Assembly, where there is a science summit every year in September, which coincides with the UN General Assembly UNGA. And of course, there are many sessions which deal with the the National Brain Health Action Plans with different countries. And of course, I was fortunate to be part of one of those. And we have been publishing a lot, sensitizing policymakers, sensitizing scientific community that why we should act together, whether we should collaborate with each other, whether we should come up with the global synergistic action plans to improve brain health for the human development, for human skill. 40 years ago, it used to be the physical assets or physical capital. Now we are talking about the human capital. If you have a population which is brain healthy, brain skill, the economic dividends are quite high. And that is why we believe now that the corporate world will think about the human capital. And many of the consultant firms like McKinsey have their brain and mind institute now, and they're working very aggressively on this to have this and action plans, campaigns, achieving global brain health action plan, and this all follows after the WHO intersectoral global action plan on epilepsy and other neurological disorders. So this is 2 years follow up after 18 months after this plan was adopted, and where are we? Where do we stand today? And where are the economic benefits? Whether we are transitioning from brain to brain positive economy, whether we have sustainable productivity, well-being of the population at a large level, so that we have a huge potential to improve brain health of the population and then make the country progress and prosper. We have no dedicated program for brain health prior to this WHO intersectoral eye gap, but we have different diseases covered under different programs. Like stroke is under the National Program for Prevention and Control of NCD. Epilepsy is in the National Mental Health Program, and RBSK, that is Rashtriya Bal Suraksha program. And of course, there are other insurance schemes from the Government of India. Dementia is part of many programs, actually. National Program for Care of Elderly, National Program for NCD, National Mental Program, Palliative Care Program, and other programs, which is, but no global action plan, which is advocated by the with action plan for dementia or any brain health. So that is where we have a disease like headache or migraine does not feature in any current programs from the national perspective in the government of India. So we are acting on to have a national program on brain health, which is very important to have that. And why we need it and integrated rather than working in silos. Of course, we have a strong foundation under the NMHP, that is the National Mental Program. They are very successful at the district level, but still the brain health remains underrepresented within the ambit of NMHP, leading to significant gaps. So the treatment gap of even 70% in mental health. Same is the program, the treatment gap in epilepsy, more than 70% treatment gap in epilepsy, even for the basic drug. So obviously we need to have an integration of patients, providers, primary, secondary, tertiary care facilities, data system research, and from that would form governance, which is heavy dedicating for the which will include all the disease which are leading to a great burden. Of course, the care pathway which we have suggested would be the prevention, early detection, management, and rehabilitation of patients at all levels of care. That means the four pillars of surveillance, prevention, detection, treatment. They are covered in this program. And of course, this is in alignment with the existing other national health program and also in synergy with the comprehensive district brain healthcare model, which I will describe. So, district hospitals, we have been investing and we have been taking this forward for last now 5 weeks. This is again 2020 again in the national deal that we need to strengthen our district hospital. We need in the each and every 750 districts where we have the district hospitals in plane. These are secondary level hospitals which back and forth referral linkages with the primary health services as well as for the super specialty and state of the art center for excellence services in the country. So obviously we need to have this strategic Indian Brain Health Initiative, which we have started about 1 year ago. And of course, we have the goal of establishment of brain health clinics at the district hospital of the aspirational districts, which are not so well in terms of economic condition. So 130 districts in the country have that fall below that line of parties. Obviously, they need to be strengthened, and we are providing comprehensive preventive, promotive, and rehabilitative services in addition to the diagnostic and curative, with the aim to ensure brain health for all. So that means we will improve the brain health in all the districts, including preventive, promotive, restorative brain health. We aim to reduce the burden of neurological disorders like stroke, epilepsy, headache, PD, and other neurodegenerative disorders like dementia in these targeted districts. And of course, we need to develop a continuum of care once the patient is diagnosed. That means from lower level to the higher level, we need to have a continuum of care for the neurological disorders. And these are the model which is the participating district under the direct administrative control of district magistrate. And we have the National Task Force on Brain Health and my hospital giving hand holding and training program. And of course, it is supervised by the Ministry of Health and Family Welfare and 𝐸𝐴 for the aspirational district program. And it's funded by the 𝐸𝐴 about 10 million rupees for each district be funded by this. To begin with, we started with these 12 districts across the country, one in north, south, east, west. So these are the districts which we have chosen based on their economic conditions, and all of them under the direct control of Niti Aayog. And we did provide them the training initially, and the training program was repeated again. And of course, the recent budget now has again there's a focus on brain health in that budget. I'm grateful to the Finance Minister of India and the Prime Minister, Honorable Prime Minister, that taking brain health agenda at a national level and including in the national budget, which was presented on the 1st of February this year for next year, 2026-2027. And there's a huge investment on the brain health, including new institutions, new programs, and strengthening the existing hospital. So what are those steps which are promoting through the National Task Force on Brain Health, which Andy alluded that the report has been submitted as a draft report, which is being now studied by the stakeholders, and that will be formally launched the next month, in the month of April. So we need to create a society which prioritizes and invests in the brain health and embraces neurodiversity. So I'm talking about at a level, regional level and a global level, not only in Indian context, but also South Asian context and the European context and all other countries which we have now been discussing global brain health partnership. We also need to promote brain healthy habits from a very young age, whether it is lifestyle change, whether it is sleep, nutrition, or it is social media, or it is the control of diabetes, hypertension, or having a physical activity and reinforcing the cognitive gyms or cognitive activity, making social connections, connecting, remain connecting. So all these things, lifestyle habits need to be changed to have a better brain health. And of course, we need to have a effective program which is accessible, available, affordable, and adaptable to prevent, treat, and help people recover from the brain disorders. So with that, I will finish here. And of course, we need to keep our brain healthy, whether it is mental health, whether it is pollution, or it is our habits which are physical activity or cognitive activity, challenging your brain cells, having a nutrition, balanced diet, remain socially connected. Of course, keep learning, whether it is learning a new music or a new language, adequate sleep with refreshing, and of course, the water, hydration, and exercise. And of course, these colorful fruits and vegetables, they're very good for brain health. And I wish we will all be addicted to all this. Thank you very much. And thank you, Andrea and Laura, for having me and having this webinar. Thank you. And we're looking forward to Dr. Jafri's, Professor Jafri's, in, of course, having these webinars, many more webinars to come in future. Thank you once again.
Thank you so much, Dr. Damija. And first of all, a really heartfelt congratulations on that major achievement. We have been discussing this, I think, for the last, I don't know, 2.5 years.
3 years.
And 3 years almost, yeah. And I know what an effort it is to bring together so many stakeholders and to have such a high level task force in the most populous country. I mean, it's a subcontinent. I think that the report of your Brain Health Task Force will be one of the most important worldwide. And I really hope that Niti Aayog will be favorable and that it can be launched very, very soon. So without further ado, I see my good friend and co-founder of the Global Brain Health Partnership, Dr. Key Park, who has just joined us actually from Seoul, right? From South Korea. You just landed there. Key, if you would like to quickly say a couple of words of welcome before we come to our colleague from Malaysia. Over to you, Key.
Yeah, so sorry. I literally just came into my hotel room and got logged in, and thank you, Andrea, for reminding me. I wasn't sure what time it's going to be. Yeah, so I'm so happy to see that this work is continuing, Andrea, with bringing together the key champions for brain health. Whether it be in Africa, that was the first one, right? Now in Asia, congratulations. And Rajinder, your reputation is very well known in this space, and your close relationship with your federal health ministry and the work that you're doing. And I'm looking forward very much to hearing from you, Professor Abdullah. I think we might be fellow neurosurgeons. I'm not sure, but I think
we are.
So we are. Fantastic. We'll have to compare notes on who we know afterwards. So congratulations again, and apologize once again for being late.
It's wonderful that you were able to join despite your flight and your other commitments, Key. So without further ado, I would like to briefly introduce. So basically, we will discuss after the second intervention, and I would like to introduce to you Professor Jafri Malin Abdullah, who is a professor of neurosciences and the chairman of the Brain and Behavior Cluster at the School of Medical Sciences, University Science, Malaysia. And he's also the founder and trustee of the Brain, Mind, and Neuroscience Research Foundation. He is widely published. His age index is 31. He's a fellow of the Academy of Sciences, Malaysia. And beyond his clinical and academic work, Professor Jafri is also actively engaged in science policy and in national advisory roles. I understand that Malaysia doesn't have a brain health plan yet, but hopefully this is to come, and we will hear from you in a moment. And in recognition of his international scientific leadership, you have recently been awarded or have been invited as a fellow to the Islamic World Academy of Sciences. Congratulations to that, Dr. Jafri. And that is really reflecting Malaysia's growing presence in the global scientific collaborative and leadership world. Without further ado, now we're going to hear from Malaysia by Dr. Jafri. The floor is all yours.
Yeah. Thank you very much, Andrea. Thank you, everyone. Good evening, and thank you for the opportunity to speak at the Global Brain Health Partnership webinar. My presentation today focuses on the current state of brain health in Malaysia, a country in Southeast Asia, and the interventions currently taking place to address the growing challenge. Brain health is no longer simply a clinical issue confined to hospitals and specialists. It has become a national priority that intersects with population aging, economic resilience, social well-being, and healthcare capacity. In Malaysia, like many countries across the world, we are experiencing demographic shifts, increasing neurological and mental health conditions, and rising demands for long-term care. Therefore, today I will share an overview of Malaysia's population landscape, the current burden of brain-related conditions, the healthcare workforce availability, and how brain health is increasingly connected to economic development and national policy. Next slide, please. You have seen the objectives of this talk, which I will cover. So next slide, please. Who is who in Malaysia? Let us begin with the demographic picture of my country. Malaysia has a population of 34.2 million people. Of this population, about 18 million are males, 16.3 million are females. And if we look at the age structure, the majority are working age adults between 15 and 64 years of age, about 24 million individuals. Children aged 0 to 14 years account for roughly 7.4 million, while the elderly population aged 65 and above is around 2.7 million. Another important factor is the social economic disparity, and some states in my country have extremely higher poverty levels, such as the state of Sabah in Borneo, and my state, which I work in, Kelantan, has around a poverty rate of 11.5%. These demographic and socio-economic characteristics will influence health access, disease risks, and the burden of neurological and mental health conditions. Next slide, please. So we will see the distribution of specialists across the two continents, one in Peninsular Malaysia and the other one in the island of Borneo, where we have the state of Sabah and Sarawak. And we have the number of neurologists that we have covering these states are pretty small in number. Next slide, please. Next slide. So we see that we only have 154 neurologists. 76 are in government hospitals and 69 are in private hospitals. And if you see the number of neurologists in government hospitals, they are way all concentrated in Peninsular Malaysia and in capital cities. Next slide, please. And if we look at the number of psychiatrists, we have 622 psychiatrists, 485 in government hospitals, and 137 in private hospitals. Next slide, please. And maybe this slide will interest Dr. Park, which shows that we have 209 neurosurgeons, more than neurologists, well, of which 122 are working in government hospitals and 87 are in private hospitals. And most of them are concentrated in the Peninsular Malaysia. Next slide, please. The university hospitals that play a very important key role in clinical care and training of our postgraduates. So most of our postgraduates are trained in university hospitals under the Ministry of Higher Education. And here are the list of university hospitals. And we have some old ones and some new ones. And we have some private universities here as shown in this slide. Next slide, please. One important thing about Malaysia is our society is aging. Our next door neighbor, which is Singapore, has a very old population. So you see that the proportion of people aged 65 and above has been steadily increasing. It was 5% in 2010, and now by 2030 we will have about 9.3%. And by 2050, the proportion should exceed 50%. And by 2060, 1 in 5 Malaysians will be elderly. And the demographic shift has profound implications because most of our neurological conditions, including dementia, stroke, Parkinson's disease, are strongly associated with aging. Next slide, please. So as we can see, this is the United Nations classification of an aging society, which I think everybody knows. And Malaysia will officially become an aging society in 2021. So we are already in 2026. And the projection suggests that we will become an age society within the next 2 decades. So this transition is happening faster than many countries anticipated. Even our politicians do not anticipate this. Next slide, please. So the population pyramid shift. Malaysia's population pyramid is also changing. Previously, Malaysia has a progressive population pyramid characterized by a wide base representing many young people. However, the declining fertility rates and fewer birth rates are causing the base of the pyramid to narrow. At the same time, the upper portion of the pyramid is expanding due to increasing life expectancy. This transformation indicates a regression population structure, which fewer workers must support a growing elderly population. Next slide, please. Another indicator showed by this slide is that The median age of the population is rising. In 2020, it was 29.7 years. By 2060, it is projected to increase to 40.7 years. At the same time, the old age dependency ratio is expected to nearly triple. This means in Malaysia, a smaller working population will need to support more elderly individuals. Next slide, please. So the Malaysian population, Malaysia is just one country in the whole bunch of countries from Southeast Asia, better known as ASEAN. And we will see from this slide that Indonesia, Philippines, and Malaysia still have a relatively younger population. However, even in these young economies, the aging trend is accelerating, as seen in the next slide. Next slide, please. And we will see in the next slide that this creates what economists call a two-speed ASEAN, where some economies must innovate rapidly to maintain productivity despite demographic decline, such as in Singapore. Next slide, please. The physiological brain health burden is great. Dementia prevalence among all the adults is approximately 8.5%, and Alzheimer's disease accounts for around 60 to 70% of these cases. Parkinson's disease cases are projected to increase dramatically, possibly reaching 120,000 patients by 2040, which is just a few years from now. Stroke is another major concern. In 2019 alone, Malaysia recorded nearly 48,000 new stroke cases, with almost 20,000 deaths because the access to stroke therapy is minimal because of the divide between the rich and the poor. Alarmingly, about 1 in 4 strokes occur in Malaysia under the age of 50. So we have young boys and girls, or men and women with strokes. And traumatic brain injury also remains a significant issue, especially due to the high road traffic accidents and occupational accidents. Next slide, please. So the psychological brain health burden in Malaysia is also great, as you can see here. For instance, dyslexia affects 4 to 8% of Malaysian school children. Learning disability represents the largest registered category of persons with disability in Malaysia. Autism spectrum disorder prevalence has increased, reflected due to the improved detection and the greater awareness amongst the young parents. Mental health challenges are particularly concerning among adolescents. Recent surveys show that 1 in 4 adolescents in Malaysia report depressive symptoms. Additional trends in suicidal ideation and suicide attempts among teenagers have increased. Next slide, please. So, what does it show? This slide shows that brain health conditions are closely associated with socio-economic factors. Lower income groups experience higher exposure to risk factors. For example, traumatic brain injury is more common among motorcyclists and manual laborers. These are not rich people. Mental health conditions associated with unemployment, financial stress, and urban pressures. This highlights the need for equitable healthcare and targeted interventions. Next slide, please. So, the brain health and economic reliance. Population aging creates a double economic pressure cooker. So on one hand, the workforce is shrinking. On the other hand, healthcare and long-term demands are increasing. Future economic growth cannot rely solely on population expansion if we don't have one. Instead, it must depend on higher productivity and longer healthy lifespan, especially brain health. Strong brain health enables individuals to remain functionally independent, productive, and socially engaged for a longer time. Next slide, please. As we can see in the next slide, please. The World Health Organization defines brain health as optimal functioning across cognitive, emotional, behavior, sensory, and motor functions. And important brain health is not simply the absence of disease. Next slide, please. And we can see from the next slide that the ability of individuals to realize their potential, adapt to stress, and participate in meaningful things in society throughout life is very important. Next slide. And this is the important determinants of brain health. Next slide, please. Which is influenced by physical health, education, environment, social connection, and access to healthcare. So brain economy, as shown in this slide, brings us to the concept of healthy brain and healthy cognitive situation with good skills, good productivity, innovative brain, economic reliance. And the global brain disorder accounts for around 50% of the total disease burden compared to the disease of the heart. Estimates suggest that brain-related conditions could cost the general economy up to $1 trillion annually by 2030 in Malaysia. However, reducing the burden should unlock enormous benefits in terms of longer, healthier lives and improved productivity. Next slide, please. Therefore, the concept of brain capital extends this idea further, and it tickles our Malaysian government. The brain capitals refer to the collective connective abilities, creativity, emotional resilience, and mental well-being of a population. Next slide, please. And building brain capital involves three major phases. First is early childhood, second is adulthood, and third is healthy aging. All of these are a big problem in Malaysia, and we hope to be able to tackle this sooner than ever. Next slide, please. So what have we done in Malaysia? Have we been sleeping? Not exactly. We have started our national aging blueprint starting from last year, 2025, which will go on to 2045. And this outlines strategies covering healthcare, employment, social protection, education, and long-term care. And in Malaysia, we plan every 5 years, and we have started the 13th Malaysia plan last year. So the 13th Malaysian plan is ongoing, and it looks into how we can sort out the aging population and brain health. Next slide, please. So we also have a dementia action plan by the Ministry of Health of Malaysia. We started in 2023 and ongoing to 2030 that recognizes dementia as a growing national health and care burden. Next slide, please. And we have also, in the next slide, many other initiatives, at least 16 of them. Some of them are the reports are shown here. And we have had acts, because without changing the law, people will not do what they're supposed to do. So next slide, please. So Malaysia is also connected with the global brain health initiatives, including the WHO Intersectoral Global Action Plan, which was presented by my colleague Prof. Rajinder just now, where India is also involved, the European Academy of Neurology Brain Health Strategy, the World Federation of Neurology Global Brain Health Initiative. Next slide, please. And the World Federation of Neurology Global Brain Health Initiative, the European Brain Council, Brain Health and Research Initiatives, which we are involved directly or indirectly. But at the moment, we are just starting the involvement with brain economy, brain health, and brain capital. And I'm happy to announce that since 2 days ago, a special interest group looking at brain economy, brain health, and brain capital has been established by the Academy of Sciences of Malaysia under the government of Malaysia, and we hope to be able to collate an action plan in the next few months. Next slide, please. So what is the future, next slide, please. So what is the future vision of Malaysians in the aspect of brain health initiatives? Looking ahead, Malaysia aims to build a brain health nation by 2035. So this vision includes brain health education, early screening programs, expanding specialist workforce, strengthening research and data systems, because without data, we do not know what's happening in the poorer states, in our states in Borneo. So we need to have equal problem solving in all the richer and poorer states. Next slide, please. And we have also KPIs. So these KPIs is written here as, you know, we want to, for example, the population and prevention, we want to increase the percentage of adults which are aware of key brain health risk factors. At the moment, our adults are not well exposed. It could be because of the language problem or cultural problem or because of poverty. And as you see in these slides, we also want to increase the public awareness of brain health risk factors, expanding cognitive screening among older adults, and strengthening neurological services nationwide. Next slide, please. And what's most important in Malaysia, we are now focusing on using neurotechnology, because neurotechnology is an emerging technology in a country like Malaysia. It's already a good, helpful technology in countries in the West, even especially in Germany. But in Malaysia, these things are pretty new for us. The brain-computer interface, the neuroimaging innovations, the digital cognitive assessment tools, which will transform how we diagnose and treat brain diseases in Malaysia. Malaysia's National Foresight Initiatives recognize neurotechnology as a future scientific and economic opportunity. Next slide, please. So this is my last slide. So I thank everyone for this kind invitation. I would like to conclude that brain health in Malaysia is shaped by demographic change, disease burden, healthcare capacity, and economic transformation. Addressing these challenges require a coordinated life course approach involving healthcare, education, technology, and policy. Easier said than done. That's why I'm so happy that Prof. Rajinder is here, and I would love to listen to his problems. You know, when you do things in India, it's not smooth sailing. There are problems. And I think we Asians will have the same problems like you have in India. So maybe you are now wiser, you are able to advise us. And by investing in brain health today, we can build a Malaysian society that is healthier, more productive, and more resilient for future Malaysian generation and also generations in Southeast Asia. Thank you for your attention.
Well, thank you very much, Dr. Jafri, for this very insightful talk. Also, for me, it was very new what is happening in Malaysia. Of course, I was better informed what is happening in India. It seems a lot is happening. A lot is happening. And I would like to give the floor now to a good and fruitful discussion. Also, of course, what can we learn from one another? What other countries should we invite into our Global Brain Health Partnership discussions? We also have a colleague from the World Federation of Neurologists here with us, and we have already first questions in the chat. So I'm just going to kick off with those. The first question was from Shalini Garg. If you're still there, maybe you would like to put your actually 3 comments you had. And I think this was to the presentation of Dr. Damije on traumatic brain injuries, on brain infections among children, and the referral system and the emergency care. Quite a mouthful. Shalini Garg, if you're still there, would you like to unmute and ask your questions, please? If not, I can maybe ask Dr. Damije. Shalini was asking, are there any particular plans on traumatic brain injury at district and sub-district level in India? Because you also mentioned that traumatic brain injuries are actually going up.
Thank you, Shalini, for this question. a very important question because traumatic brain injury involves young people who are future of the country, and most of these are in their 20s, and they pose a great challenge to the services, including the not only the acute treatment for also for the rehabilitation, and they also cause a very high mortality. So the government of India and the private sector both has taken up trauma services as a big way. In a big way, the national level, state level, and regional level, the trauma centers are being established, who are dedicated trauma centers, and most of the state-of-the-art hospitals in big metropolitan cities funded by the public sector, they are now having a dedicated trauma centers, including many in Delhi now. And there are back and forth linkages from the sub-district level to these trauma centers, and of course these trauma centers to the higher up, the state-of-the-art centers, including the medical schools and the medical institutions who have specialized trauma services in the neurological setup. So that is number one, that is being planned, and that's part of our report also, to strengthen the trauma services at the district level. And that's my own passion for last so many years, that at district level we should have all district hospitals. So India has 750 districts. All district hospitals should have a dedicated trauma unit with a CT scanner, with a neurosurgeon, with an orthopedic surgeon, with a general surgeon, with an imaging facility, so that they can be under one roof, and they can be, whether it is the ICUs and the dedicated services for that. So that's being happening, and that's something very important at all levels. Even in private sector, the private hospitals, India has a dual system of healthcare. The health is a state subject, but the 70% is being provided by the private sector and 30% by the public sectors and most of the places. But still, this is the numbers, our ratio is increasing now. The government trauma centers has overtaken the private trauma centers, and there's umpty numbers of the dedicated critical care units coming up, which will have the extension to these trauma centers. So in Delhi city alone, the 9 neurocritical care centers are coming up now, which will be a great boon to the existing services for the trauma. I think this is very important, and the focus is on at the moment for the traumatic brain injury, because as I showed in our GBT paper, it has gone 3 times in last 30 years. So obviously, it does. It's not only a problem of the old age, but it's a problem of younger generation, and they are the future of the country.
Yeah, no, thank you very much, Dr. Dameja. Dr. Jafri, what is the situation when it comes to traumatic brain injury in Malaysia? Just to get the perspective of the two countries. Yeah, the floor is yours, please.
Yeah, thank you. Traumatic brain injury is an epidemic in Malaysia. You have, not only are we the country with the highest rate of obesity in Southeast Asia, we're also the country which has the highest number of cars. We produce our own cars. It's called Proton, and we also have lots of motorcyclists. Fortunately, there is a law that entails that all motorcyclists wear their helmets. And recently, the law that was enacted 3 years ago, where passengers at the back have to be belt up, especially when you have children at the back. And that has maybe reduced slightly the incidence of brain injuries, but because we have good roads and very hasty young people, hot-headed young people, so our road traffic accidents are pretty high. We are amongst the highest in Southeast Asia after Vietnam. If you remember Vietnam, you see people on their motorbikes all over the place. Ours is high velocity injury from motorbikes, from cars, and because we have good roads. So we have different centers. We divide, we have 14 states. So every state has multiple hospitals. Traumatic brain injury is not only the domain care of the neurosurgeon, but also the general surgeon. So in hospitals or areas then there are no neurosurgical services, the general surgeon will do the extradural hematomas and the subdural hematomas. When that is impossible or is a complicated subdural hematoma, then the patient is then referred to the neurosurgeon, which is located maybe 2 to 3 hours away from that hospital that does not have neurosurgical services. And once in a while, there will be helicopter services, which is provided by the army, who will evacuate that traumatic brain injury or polytrauma patient to the closest hospital, which is level 3, that has all specialty, from orthopedic, spine, neuro, ICU, MRI, CT scan, etc. But most hospitals that the general surgeons are available are equipped with at least a simple CT scan that's able to tackle brain trauma. You're able to do a decompressive cranectomy or craniotomy. So, and that is also, I'm also speaking for Borneo, because my hospital has produced 155 neurosurgeons out of the 209 that was listed on the slide just now. And most of them now are working in Borneo, not in 𝐂𝐮𝐫𝐢𝐨, which is the capacity, but also in the outskirts of and the depths of the Sabah and Sarawak. So I think we are slowly improving. I wish we could improve further, but money is always a problem. Finance is always, because we need to buy equipment every time we open a new hospital. Thank you.
Thank you so much, Dr. Jafri. The next question comes from Dr. Chakraborty Shabani. You can also please ask the question yourself if you can. Maybe you are driving or in the car. It is, yes, you can.
Andrea, I can ask the question, but I'm not turning on my video. Firstly, very interesting presentations from Dr. Dameja and Dr. Abdullah. And I think, Dr. Abdullah, what you just said about the expansion of services already begins to answer my question. But I was wondering how brain health equity, the concept of equity, is also being embedded as you expand the planning and policies around brain health, both in India and Malaysia. Thank you.
So would you like to go first, Dr. Jafri, and then Dr. Dameja will follow? And brain or equity within brain health policies.
Yeah. Okay. The policy is that mental health should be accessible to both the poor and the rich. That's very important in Malaysia. So we have 3 types of health system. One is the government hospitals, where you pay about, I think, 0.2 euros or something to be able to be seen by a psychiatrist. And most hospitals, because now we have more number of psychiatrists than 10 years ago. So even a person who is not so rich will be able to see a psychiatrist at least within 2 weeks of his referral by a general practitioner. So that's improved. That's good. Number 2 is that patients with mental health issues and psychiatric issues are not only those who are in the illness domain, but also in the wellness domain. So in the wellness domain, even non-hospitals, we're talking about factories, we're talking about government institutions, have now increased their number of counselors. So these health counselors who have a degree, a Bachelor of Science or Bachelor of Arts in psychology or Bachelor of Arts or Science in counseling, will counsel a worker which has mental health illness or which has got disturbed anxiety, etc., when they are working, so that they will be able to be seen by a professional before they break down and then they enter into the realm of the illness, where they will have to come to our hospitals. And our hospitals are the distance from the place of their where they live to the hospitals can be as far as 60 kilometers. But remember that transport is expensive in Malaysia, and now it's more expensive since the war. So coming simply to see a psychiatrist or a specialist in mental health to any hospital in Malaysia will entail money. So that's why most of the district hospitals, we call it tier 1 hospitals, have got a psychiatrist. If not a psychiatrist, a visiting psychiatrist. So here we are tackling both the world of wellness with anxieties and stress, and we're also tackling the world of illness where you have psychosis, etc., etc. So, but we still do not have enough right people in the right place. Most of them are, our psychiatrists are based in urban areas, in cities, not in the rural areas. And remember that 70% of the Malaysian population now are in cities. There's migration from rural to urban areas. And the other 30% are in the rural areas. And the rural areas are the areas where these people need the psychiatrists and counselors as well. Thank you.
This was an excellent example for brain health equity from the psychiatric/mental health perspective. Thank you so much. And that comes from a neurosurgeon. So you see this interdisciplinarity and integrated approaches that we need and we would like to flag through the Global Brain Health Partnership in particular. Dr. 𝐶𝐵𝐤, a good example of brain health equity in India. I guess there are many, but maybe you can elaborate on one.
Certainly, that has been the priority of the neurology community as well as the psychiatric community, including the neurosurgeons, to think about having regional imbalance. And India is a very heterogeneous country, as I showed you in the map, with different socio-demographic indexes. Some states are very well off, some states are not too that rich in their economic conditions, and including the urban-rural inequity, the state-wise inequity, the national inequity. So there are a lot of challenges in that, and of course, the neurologists and the psychiatrists, they are more concentrated in the urban areas, in metropolitan areas. So accessibility to these services is much low in the rural areas and far-flung areas, and people have to travel a lot to come to seek the professional help. So that is something very important. And I think I showed you the 12 districts which we have adopted now under the Indian Brain Health Initiative. They represent the one of those from the poorest districts of the country, where the health systems are not so well developed. So to address that inequity challenge, we have selected those areas where brain health services are not that robust. So obviously, the government has the plans to expand these services to all the districts of the country, that is 750, and each district hospital having a dedicated brain health clinics. One state has already done it. Obviously, whether it is the infrastructure or it is the human resource, both are being looked after. There are challenges, there are variation, there are heterogeneity, there are different cultures, there are different languages, there are different level of economic prosperity in the country, but still, I think this gap is being narrowed from the policy perspective, and I hope that would continue, whether it is the mental health, where there is a huge gap of 70% in the treatment, or it is the neurological disorders, or it is even in epilepsy, which carries a lot of stigma, and of course the mental health literacy, poor mental health literacy. So all of these challenges are being taken care, and I'm sure that the example which I gave you from the Indian Brain Health Initiatives demonstrates widely that there is inequity, but there are challenges, and we are looking out at that.
Yeah, no, Dr. 𝐶𝐵𝐤, this is well understood. One question for me before we come to another question on environmental determinants. Now, we do have the National Brain Health Task Force in India with the report. There are many different actions, particular action plans actually in Malaysia on different diseases, disorders, neurological disorders, neurosurgical disorders. Is there an overarching brain health plan in Malaysia? There was a brain health vision. That is something that you showed. So maybe you can tell us a little bit about that vision that Malaysia has, and how does that compare to the Indian Brain Health Task Force? So you can also talk to one another, Dr. Jafri and Dr. Dameja. But this is the idea of bringing partners that are at a similar level together and see how we can actually learn from one another. So Dr. Jafri, please.
But I'm happy that, Rajinder is proactive. He contacted me, and I told Rajinder a few months ago that Malaysia wants to learn from the Indian experience, because our population, whether you like it, even though we are a smaller version of India, we're only 34 million people. We are multicultural, multi-religious, just like India. We have rich people. We have people in poverty. We have even poverty in the urban areas. We have malnutrition even in capital cities, and we have children with cognitive dysfunctions. So those are the problems seen in India at a larger scale, because you're a populous country. So, and Malaysia is not as rich as India, and neither is India as rich as Malaysia. So the finance, everything needs money, and everything needs strategy, and everything needs time, and everybody needs to be patient, and you need to have implementers. So I'm very happy to ask Rajinder after this, how on earth did he get implementers? Because in Malaysia, we are good planners. You see the books that I've showed you the slides, beautiful books, color books, they smell really very nice. But who is going to implement all the plans, the projects that we want to do? And if we cannot do this properly, a book with its plan will just be a book. And that is what I want to learn from Rajinder. How on earth did he manage to get people to move around in India through so many levels of social disparity, and try to start some projects, which I think we should do. And now, since the Academy of Sciences of Malaysia has officially has this SIG, Special Interest Group on Brain Economy, which will be directly associated with brain health, directly with brain capital, and this is the only way to move. And in the Special Interest Group are doctors, are economists, are specialists, are people from the Ministry of Health. I think it's about time we learn from India what we can do in Malaysia. What India can do maybe in 5 years, Malaysia wants to do in 2 years. It's not easy. We have to have good implementers. But if we know the mistakes or the problems, the mountains that Rajinder has to climb over in India, then we can make it into a small little hill in Malaysia, so that we are able to move faster than our friends in India. That's very important to me. That is my message to you, Andrea, because I'm happy that you have had this webinar, and I think it is going to be very impactful, not only for my country, but remember there are 9 other countries in Southeast Asia whose healthcare is worse, except Singapore, was worse than Malaysia. We need to help our friends in Myanmar, in Laos, in Cambodia. We want to help our colleagues in Thailand, in Indonesia. And we want to set example as a country in Southeast Asia, with the knowledge from Rajinder and team, and also from the Center for Global Health, to be able to help our population in Southeast Asia, because we all deserve good brain health. Thank you.
That is wonderfully put, Dr. Jafri. And I have to say, even Germany and Europe can learn from the Indian example, because in Germany, for example, we do not have a strategic national brain health plan. We don't. And it's actually, the interest is not that high, which is surprising, because we have a large population of elderly. Now, Rajinder, would you like to react? Just a couple of minutes. We have 10 minutes left, but maybe you can just take a couple of minutes to react to what Dr. Jafri said. And maybe, Rajinder, you could also, to our few listeners that are still on the call in the webinar, you could maybe explain how that task force came about, the different steps, and that, of course, is also a learning information for Malaysia and for other countries in that webinar. Over to you, Rajinder.
Thank you, and thank you, Jafri, for the kind words. I think it's not easy. You are absolutely right. Nothing is easy. But if you have a political will with you, if you have the right team with you, so obviously things become a little more practical. So it takes a lot of effort, it takes a lot of conviction, it takes a lot of convincing power to make the policymakers understand. One of the reasons why we have been able to convince the policymaker is to show them the benefit, the results. So $1 invested in brain health can yield so many dollars in return. So and then you show them the outcome measures, they're quantified. So if you prevent, say example, stroke by 20% in next 5 years, these are the numbers which economists and the policymakers love to hear. That yes, these are the numbers. If you prevent dementia, or if you prevent epilepsy, or you prevent infections, or you prevent traumatic brain injuries by 10% to 20%, 10% of 1.5 billion people having exposed to this kind of problems is a huge number. So obviously, I think the policymakers love to hear the benefits of having any plan, any action, any program, and that way the neurology fraternity has taken very important advocacy program here in India. The bunch of leadership in neurology and neurosurgery, they have taken this task on their shoulder, and they have been leading by example to convince the government, people, and the stakeholders that we should talk about brain health. We should have a national program for brain health. We have different national programs. India has been very successful in eradicating polio. The world is amazed at how we did it. The Pulse Polio program. So the public health programs have been quite successful in the Indian context, in spite of heterogeneity, in spite of large population. But slowly success, and then of course the policymakers and the stakeholders who listen to you. And I think the idea is take one task at a hand, finish it, show them as a pilot, and then take it another one, rather than doing so many things. So we also convince the people to, stakeholders, to the Planning Commission or Niti Aayog, to have the task force, to have at least a situation and analysis, come up with a plan, come up with the program, come up with the recommendation, which we have already submitted now. And that recommendation will not be just a bunch of papers or files or books. That will be taken it very seriously at the highest level. And I'm sure that this task force will have the results and example to the others also.
Thank you so much, Dr. Dhamija. That was very, very good and very helpful advice. I think it depends a lot on the willingness, on the political will. The fact that the the Medical Academy of Malaysia is interested and has already put together a task force, that is the first step. Brain health should be the umbrella, and different disciplines definitely need to sit at the table. It needs to be integrated, like neurosurgery, neurology, psychiatry, you name it. But also people who know well the brain health determinants. And we do still have two questions in the chat. One is on the environmental determinants. Pollution, obviously, is the first thing that comes up, or climate change, but also biodiversity loss, which changes the vector system, vector control, and may give rise to already known or unknown infectious diseases that could also affect the brain. Now, another issue is neurotechnology. Dr. Jafri, you mentioned it, that Malaysia is also very keen on taking on the new technological advances at different levels. I was also surprised to hear that your neuroimaging equipment seems to be absolutely up to date and quite well distributed. So maybe the two of you could comment on environmental determinants, how this is taken on board by the various policies, action plans, and of course the task force that you have in your country, and also neurotechnology. We start maybe this time with Dr. 𝐶𝐵𝐤, and then we go to Dr. Jafri. Please, 1 minute each. So we have to close in 4 minutes.
Thank you. So I think I'll quickly touch upon first the technology. So India had a very big AI summit in this month only, in a couple of, in the February, the global summit where 60 head of the states came, and including the French president and the other European president. So obviously, AI is a big way of healthcare in India now, whether AI in mental health or AI in brain health. So we have taken an initiative to introduce the artificial intelligence and the technology to help us, whether it is even the screening, cognitive screening, as somebody mentioned, in a computer-based or AI-based computer cognitive screening. The different apps coming up, different startups coming up, which uses, you have now so many variables and watch and who can give you your heart rate, your portable EEG, and all these things are happening. And I think the future lies in the technology, in whether it is brain-computer interface or whether it is the assistive devices or it is the communication gadgets. So I think AI has a big role to play, and we should embrace the AI with the real intelligence. Of course, I strongly believe that AI, artificial intelligence, we have to implement both of them to get the maximum benefit of that. About the pollution and climate change, of course, again, a very sensitive issue, and a lot of work is being done here to reduce the pollution, and there are a lot of studies going on the effect of having climate change and pollution for the neurological disorders, and time will tell us what steps are required for these things. At the moment, the environmental reductions are being talked about, and the effects of these environmental effects are being studied.
Thank you, Dr. 𝐶𝐵𝐤. And a very quick comment, please. Again, 1 minute, Dr. Jafri
in
from
Malaysia.
Malaysia.
Thank you, Andrea. In Malaysia, just like India, we are AI crazy now. So we're using AI. Everybody, even the poorest person has a handphone. So AI is being introduced for stroke caregivers, even those with mental health and their caregivers. So AI is coming in 3 different languages, Malay, English, and even in Tamil, to our multi-cultural speaking population of Malaysia. And as we talk about the environment, we have more issues with weather changes, hot weather, and unclean water. That's the main problem, unlike India, where air pollution may be its biggest problem. So we are also looking into this to improve the quality of drinking water and agriculture water, and also trying to reduce the effects of heat on the poor population. Thank you.
Thank you again for sticking with time, Dr. Jafri, and for those comments. We could, the last comment in the section here from a colleague, Dr. Jamuna, is EEG neurofeedback training in neurological and psychiatric conditions is showing significant improvement. Very well put. I mean, this is really from the global policy level down to the more technical level. I think there's so much left to be done on brain health. We are only starting, and the whole thing is that our policy makers still do not seem to understand how important it is. But there is progress in Malaysia, there is progress in India, there is also progress in other countries. And I'm only left now with really thanking our 2 speakers, thanking the audience for those who stayed until the end. We will travel again the world. The Global Brain Health Partnership should maybe land next time in Latin America or somewhere in the Americas. If there's particular interests, Dr. Jafri and Rajinder, from Southeast Asian countries or key, maybe from South Korea or any other Southeast Asian country, we would be very happy to have another webinar with those countries. Please do contact us and do introduce us. And I do not want to close without really Key Park to have the final words. Thank you so much to everyone, and also to Laura for the back office work. Thanks a lot. Over to you, Key.
Thank you, Laura. Thank you.
Thank you. Yeah, I'm so sorry I missed Rajender's talk, but Professor Jafri, your talk was fantastic. Great questions, and I'm just left wondering, like at a high level, the intent and right now the conditions are so good for different specialties, different people from these silos to work together. And it is a perfect example. We have neurosurgeons and neurologists really well aligned. So the questions I have is like, are we doing enough to bring the other partners into this discussion? Are our activities that we're doing to help brain health, are they aligned and coherent? Are we optimally leveraging each stakeholder's networks and resources to achieve what we want to achieve? And are we doing the kind of research in a collaborative way to answer some of these key questions? So I leave it as a sort of a challenge for all of us, but I think we need more webinars like this, Andrea, and we should maybe even think about convening something in person. So congratulations. Thank you.
Thank you
Thank
to
you.
all.
Thank you.
Thank you, everyone. Thanks for.
Stay in touch, Dr. Rajendra.
Sure, certainly.